Hello, I'm Jean Sullivan, and I direct the Center for Health Law and Economics at UMass Medical School. And I've been asked today to give you an overview of the basic structural and financial components that would be necessary to understand in order to either establish a new relationship between a university and the Medicaid agency, or to build upon or expand what some of you may have already started in the way of engagement with Medicaid agencies, or for those of you who are in the state agencies who are interested in using the resources of your state university to support the administration of Medicaid program. So today I'd like to cover, first of all, the basic key principles for a successful relationship between the university and the agency. What we think are the most important features to build into any new relationship or any relationship that you want to expand. I'm going to review what the Medicaid program is, how it is structured under the federal law, and how each state builds its Medicaid program. We'll focus on what's known as the administrative expenditures that Medicaid programs make, because that's the arena in which universities support Medicaid agencies. Then we will talk about how you need to establish a formal linkage between a university and the Medicaid agency, and this is absolutely key to the ability to leverage what I'm sure everyone is interested in, which is the availability of federal matching funds for the expenses that are incurred. We also are going to describe at a high level the various ways in which the university's activities in support of agencies can be compensated. And last, some basics around what type of funding and funding sources are permissible in paying for the initial cost of these expenditures, and therefore eligible for match. So beyond all the details of what's required legally or what the financial structures or accounting needs to be, the most important thing to a sustainable and successful relationship is having champions in the university and also at the state agency you're going to be working with, who understand the essence of the added value of building this kind of relationship, that understand that the opportunity is one that benefits both partners. And preferably, the best champions are individuals who have in their own career and their own backgrounds experience working within academic institutions, as well as some experience working in the public agencies. And this is because the cultures of the agencies and the culture of a university and an academic entity are often quite different, and being able to understand the differences allows you to also understand the competencies and the possible contributions each of those parties make to a good relationship. There are also accountabilities that any academic center has to be cognizant of and has to serve, as well as accountabilities of a public agency. And when the parties to any one of these partnerships appreciate what the differences are in those respective accountabilities and where those opportunities align, the better this works out. Sometimes the relationship can be strained when there is less than a full appreciation of what's driving a difference in agenda, if you will, on the university side, or in the case of agencies, external factors that drive their pace and regular day that is beyond anything that an academic center would have to accommodate. So, as you might imagine, the differences in culture and structure and accountabilities in this relationship also creates some basic challenges, and it's best to be aware of what these basic challenges are and to deal with them directly, and be sure to introduce the actors who are going to be the main custodians, if you will, or managers of the relationship between the two institutions to sensitize them to what is likely to be the challenges. So first, academics, first and foremost, are interested in research. A federal public assistance program like Medicaid, however, has to operate within federal limits. And in most cases, research on a Medicaid population or a Medicaid program that involves identification of individual enrollees is not permitted under federal law. Instead, what is permitted is that any activity that contributes to the efficient or proper administration of the program, any activity that contributes to the improved operations, to better analytics in administering these complex programs that Medicaid are, is permissible. And you need to find the areas of alignment between the things that are necessary for administration of the program and what would make an interesting area for academic pursuit. And these are not hard to find. We'll talk about that in a moment. Data sharing agreements. Medicaid programs are the largest programs that states operate. They're full of complexity. They involve the expenditure of anywhere from 20% to 40% of a state's budget. And the information about these programs is in the realm of megadata. Being careful to think about how you want to arrange for data sharing, whether the data is going to live at the university and housed there, and the university staff will have custody of that data and create data analytics, or whether the data will be shared on a project basis is something to be sorted out in advance. State agencies are, by nature, political organizations that have to respond to a lot of external demands from legislative leadership, from their governor's office. Priorities change. The state agency is built for that kind of agility to accommodate changes in priorities. Academic institutions are not as flexible, not as agile, and finding a way to be responsive to that kind of changing environment is one of the key challenges. The most academic programs come around to designating a particular office or department or division to be the front-facing organization for state agency interactions. I want to turn now to the basics of the Medicaid program, its purposes, and how it's funded. Of course, the program funding is one of the opportunities for both state agencies and the university, and understanding how to capture that funding is the main objective of this presentation. So it's important first to understand what is the purpose of the Medicaid program, because the university activity that falls within those purposes and university activity that can contribute in a meaningful way to the improved administration of the program is where all the opportunity exists. So the program is jointly funded by state and federal government. It provides medical assistance to low-income individuals. It focuses also on the provision of rehabilitation services and other myriad of support services to those who are challenged by disabilities or other chronic conditions that create functional impairments where services are needed to maintain independence. The Medicaid program at the federal level also provides a significant source of funds for the state's costs of running the program. Those are called administrative expenditures, and it's in the provision of services and expertise that universities can add a lot of value to the effectiveness and success of the administration of this program. The complexity and sheer size of Medicaid programs in each state makes the administration of Medicaid one of the most challenging things that public officials have to accomplish. And the universities have a full array of subject matter expertise and a knowledge base and analytic tools that can contribute in a very significant way to the success of those program administration. A little bit more on the federal and state program funding. As I mentioned, this federal matching funds that are available are known as Federal Financial Participation, or FFP, and each state has a percentage match rate established, which is directly related to the per capita income of a state. So the more wealthy a state is, the higher that match rate is, and vice versa. But the minimum is 50%. That variable rate applies to what's called program expenses, which are the direct medical services to eligible enrollees. And then there is a different match rate, almost always set at 50% of expenses, for the administrative activities that are necessary to run the programs. And we'll talk a little bit about what the whole range of those administrative activities might be. There are some opportunities for higher rates of federal matching on the expenditures made by universities or agencies in employing the resources of universities. And those tend to fall into two areas. Systems development, including all the data analytic systems, and skilled medical professionals that are needed for the administration of the medical services in the Medicaid programs. I'd like to talk now a little bit about some examples of what we mean by the administrative activities necessary to administer a Medicaid program, and they are quite broad, and I've highlighted here in counter color the ones where universities have a lot to offer and can engage with agencies to provide their expertise. So obviously it's a medical assistance public program, and eligibility determinations drives it. There are the delivery of medical services involves the need to engage in clinical quality control and ensuring enough access to those services, which has to do with the capacity. Do we have enough physicians, enough hospitals, et cetera? And in building expertise in the clinical area is one of the key areas where universities can contribute. Medicaid, because it is publicly funded, is statutorily required to be the payer of last resort, which means it must look at all sources of third-party liability, that's TPL, and coordinate the payer sources, if there are third-party payers, with the public payments. That's coordination of benefits. The next areas are more ripe for university participation, managing clinical quality, utilization of services, and determining the cost effectiveness of services, or determining the effectiveness of services in affecting better health outcomes. Program integrity, monitoring and analyzing the outcomes of programs, evaluating new initiatives. Program and policy development is an ongoing activity for all state Medicaid agencies, and universities' ability to do research and rigorous analysis is always an area ripe for development. Planning grants and new programs under what's called waivers, that where innovations and innovative approaches that states want to take with their Medicaid programs often requires and is benefited by the addition of academic supports. Also, improving the effectiveness of the care that's actually delivered is an area that is a focus under the Affordable Care Act. There's new funds available to support that kind of research and analysis, and is an area that I think is important for universities to think about when approaching the Medicaid agencies to offer your services. Now, administrative expenditures, in order to qualify for this federal match, have to be articulated in what's called a cost allocation plan. Each state has its own cost allocation plan, and if it has not engaged in any activity with its university partners to date, it will have to amend that plan to describe the kinds of administrative activities that a university is about to provide for it. This is essential in order to document and to qualify the activity for federal match. Other state agencies and as well as the universities are also involved in administration, and no matter what other entity other than the Medicaid agency is involved in activities, it's important that the financial officer, the chief financial officer of the university and his or her staff is able to document those expenditures and certify them as having been directly related to a Medicaid. There are, I mentioned documentation, and that's because in the end there are general provisions in law describing and defining administrative expenditures. However, the final arbiter of what is recognized as necessary to the proper and efficient operation of Medicaid is the Federal Oversight Agency, which is the Centers for Medicare and Medicaid Services, or CMS, and the Office of Inspector General for the U.S. Department of Health and Human Services also is involved in the oversight of the Medicaid programs nationwide, and frequently and regularly audit expenditures submitted for federal matching. And when a university has an ongoing relationship with a Medicaid agency and has some significant critical mass of activity, it is not uncommon that the federal agency will also look at not only the state agency's records of expenditures, but at the university's expenditures as well. The actual claim for FFP is always submitted by the state agency, but the university's role is in documenting the expenditures and certifying that they are related to Medicaid. I'm not going to go into too much detail. You'll see on the slide that the determination of the costs are regulated by OMB's circulars, and the basic principles that guide how costs are counted are not dissimilar to the same principles that your finance staff at universities use in documenting expenditures for grants or other contracts with other entities. It's not uncommon as well that universities have departments that might be involved with, we'll use the Department of Public Health, for instance. The team, faculty and researchers might be involved in studying immunization and the challenges or barriers to increasing immunization, for instance. Some of that work might be directly related to supporting a Medicaid agency's new initiative to get more Medicaid recipients immunized. Some of the activity might be involved in a much broader universal demographic. And when you have a mixed effort like that, it's important to be able to figure out how much of the total operations of that research group, if you will, is directly related to Medicaid and how much is really just of general interest to the general population's health and improvement. And that is the essence of cost allocation. There are rules about how you allocate and how you document that allocation, and that's important for capturing FFP when you have teams in the university that are simultaneously involved in activities that relate to Medicaid and other areas. I want to talk now about the need to have a formal link between the university and the Medicaid agency. And what I mean by formal link is literally a contract or a written agreement. It's important. Most at the base that the agency recognize the activities of the university as being related to Medicaid. So there have been instances where universities are engaged in Medicaid relevant inquiries, say in a school of public health or school economics. But if that activity hasn't been in advance described and described to the Medicaid agency, and the Medicaid agency has not asked for that work to be done or isn't able to connect that work directly to what's necessary for maximizing the effectiveness of the Medicaid program, then you're not going to be able to get a federal match. So the reason you have this formal linkage or agreement is to demonstrate to the federal oversight agency that's funding this that the Medicaid agency has in fact sought out this activity and can describe how that university activity is going to support the program. The agreement needs to be signed by the Medicaid agency and the person who's going to be able to bind the university to an agreement. And the description of the activities that the university will be performing needs to be spelled out at a level of detail that allows any auditor to understand which pieces of the university operations are going to be, are relating to the Medicaid. This is another reason why universities who engage in these partnerships set up designated offices or departments for maintaining these relationships so that procedures that track expenditures can be established and simplify this process. The next step is to, after describing what will be done, is to start to track what actually occurred and what actual expenditures are. The match rates are always based on costs, on actual expenditures, not by billing rates or hourly rates, et cetera. And last but not least, once these actual expenditures are certified and documented, the FFP claim is submitted by the single state agency. Now, assuming that you've been able to meet with your state agency partners, you've established the agreements, you are clear about what activities are going to be performed, and you've actually performed them. Most important is how you take the added FFP that's now available for all those expenditures and use it to compensate the university for the activities. And there are 3 ways that states do this, and all of them are permissible, and depending on circumstances, you might use 1 or 2 or all 3 of these. The first is a direct appropriation from the Medicaid agency to the university, usually through some sort of interdepartmental service agreement, ISA agreement so-called. And in this case, the agency pays for the full costs incurred by the university in supporting the Medicaid program. And the agency then certifies and submits those total costs to the federal oversight agency and collects the federal or monies, or FFP, to reimburse itself. In this case, no certification by the university is required because the agency is actually certifying. And the FFP does not need to flow back to the university because the agency has already paid 100% of the costs incurred by the university. More common is a situation, the second approach is to basically leverage some state funds appropriated to the agency and then transferred to the university, as well as leveraging FFP. So in this case, the university is going to be compensated in part by state agency flow, and the remaining portion of their total costs will be reimbursed by transferring FFP that has been generated based on the expenditures that the university has made. It's important here to remember that your legislative body is in charge of directing where FFP is credited, and you will probably need to work with legislative leaders, your Ways and Means committees, to get explicit language that allows the FFP that's earned by the agency, the executive branch and the single state agency for Medicaid, and get it transferred to university accounts. The third approach is one that reimburses the university by only federal funds. And this is a situation where the university may be involved already and have an independent source of funding. We'll talk about that in a moment, for its activities. But because the activity has been recognized by the Medicaid agency as related to the administration of the program, the university can certify the expenditure of its own funds, as long as it's a permissible source. Again, we'll talk about that in a moment. And that certification can then be added to the Medicaid agency's claim to the Federal Oversight Agency, and they, again, takes legislative authorization. The FFP that is generated can be credited to the university accounts. So you may recall that I had said that there are matching rates of 50% and sometimes enhanced rates of 75% and even 90%. What the university is getting here is partial reimbursement of its costs, which is a benefit if you are working with external funds or other sources of funds. By being able to draw down and get the benefit credit of the FFP, you can make the other source of funding stretch that much further. So every $2 of grant money that might come in for that same activity can now fund $4 of cost because you've got this FFP flowing. Any public entity, whether it's a state agency or a public university, is expending money for Medicaid relevant activity, and it plans to be drawing down federal matching funds for those expenditures. It's important to consider what the source of the funds for the expenditures have been. In order for FFP to flow, federal law requires that the source of funds also be public and non-federal. That is in the essence of what is meant by shared funding. The federal government is interested in seeing that some public entity has contributed non-federal and public funds to the expenses of operating the Medicaid program. So that means that if the university has appropriated accounts or has other public funding from local sources, that those funds can be used. The operating budgets of a public university are considered public funds, so those would be permissible. You can also have permissible donations, but what permissible means is not a quid pro quo kind of donation. The donation can't be made to the university in return for the university to pay the entity back again. Grants can be, funds can be the source of matching, particularly if it's a public grant-making entity and non-federal. Private grants, there's an asterisk there because they could be a source of match, but only if the private funds are donated or made available without an expectation of payment back. And normally the funds need to be under the control of the Medicaid agency, either by agreement and by execution of a document that makes that clear. So that would require a case-by-case review. Rarely, but sometimes, there are federal grants that are allowed to be the basis of matching funds under Medicaid. Title 19, by the way, is the title of the Social Security Act that comprises Medicaid. And then, of course, we've been talking about public universities, but there's also structures of public universities that are more or less public than others. There are factors that any reviewer, whether it's the Federal Oversight Review or courts, that are considered in determining whether a university's own funds, operating funds or otherwise, are public or public enough to qualify as a source of spending for FFP claiming purposes. And the kinds of things that we look at are what the enabling legislation for the establishment of the public university says about its public purpose and mission. Does it receive state appropriations? Is it ultimately liable for the debts and legal judgments that might be pressed against the university? That's key. If the state is ultimately liable for the payment of that, that's considered public. And also governance structures. If the university is run by a board, are the board members appointed by the governor? Does the legislature control the appointments of the board or the powers and limits of the authority of the board? So public universities have variations in how they're structured, and some may have portions of the university that qualify as public, whereas other parts may not. So today's presentation, as you know, and as you probably can tell for now, touches on a lot of complex ideas. And if any of you are interested in pursuing more of this, you're free to contact me or my colleagues here at the University of Massachusetts Medical School. I hope you have enjoyed the presentation and that your partnerships are improved as a result. Thank you.